Welcome to Tung Talk, the first ever podcast dedicated to Master Tung's style of acupuncture. Here are your hosts, eternal students and teachers of Chinese medicine, Shaun Goodman and Moshe Becker.
Hello, acupuncturist friends from all over the blue planet. My name is Moshe Becker, and I'm a Chinese medicine practitioner and teacher. I'll be sharing my clinical experience and be the one asking the questions. My fellow co-host, friend, colleague, and teacher, Shaun Goodman, will be answering them. We will mainly discuss Master Tung's approach prevalent in Taiwan, which is different from the one taught in the West. This lesser-known approach has revolutionized the way we treat our patients who seem to love the results. We thought it's high time we shared this knowledge with the global acupuncture community. We really hope you've enjoyed the first 3 episodes of our freshly squeezed podcast. Today, we are going to talk about Master Tung's Dharma concept. So, without further ado, let's dive into the 4th episode of the Tung Talk podcast. Hey Shaun, long time, what's up?
Hi Moshe, yeah, long time. Great to be here again with you.
It's great to be back with you here again, my friend. Let's jump straight in. What is the literal meaning of Dharma?
Most of us are familiar with the Tao character as the path, the way, the road. But in Dharma, this is not the case. Here, the meaning of Tao is to move backwards or to turn upside down. And the meaning of the character Ma is horse. So, the literal meaning of Dharma is fallen horse. The term Dharma first appears in the clinical record of the treatment of President Lon Nol in 1971. In his 1973 textbook, Master Tung originally named the method Hui Ma. Hui means return, go back. So essentially, Hui is pretty much the same as Tao, the term more popular today.
Great, interesting. So clinically, what does Dharma mean?
Dharma is one of Master Tung's needling techniques. Usually, Dharmas consist of 2 or 3 points needled relatively close to each other. Some Dharmas even consist of 5 or 6 points. The points are often located on the same line and thus have the same shenjing. Master Tung found that in chronic diseases, Bi-Zhong, rheumatism, develops in the tissue. This rheumatism requires a strong stimulation to unblock. One needle is simply not enough. Using 2 or 3 needles can efficiently unblock the obstruction and allow free flow of qi and blood in the tissue. So, to my understanding, in Master Tung's acupuncture, there are groups of points located on the surface of the body that correspond to the internal organs and certain areas of the body. The shenjing attributed to these points describes its correspondence. We should note that when a disease develops in one of the internal organs, the corresponding tissue on the surface of the body may change, and over time develop rheumatism. Needling the area with 2 to 3 needles, what Master Tung calls Dharma needling technique, can trigger a response in the corresponding internal organ and help retrieve its health.
Are all the point groups located on the same Zhang channel? And are there Dharmas that spread to different Zhang channels? And lastly, Shaun, are there Dharmas which are not linear?
Yes, all the Dharma groups are located on the same Zhang channel. However, there is an exception, the triangular Dharma needling technique, in which a point from one channel is added to 2 points from a different channel, parallel to the channel. This way we can cover and treat a broader area. Of course, this triangular Dharma spreads over more than one channel. A clinical case I had recently would best demonstrate the positive effect of the triangular Dharma needling technique. A female, patient age 51, came to me with severe shoulder pain. Examining the 4-flower line, which runs on the leg Yangmin channel below the knee, I noticed a dark blood vessel in the area of Sihua Zhong, 7709. Upon palpating the area, I realized that lateral to 7709, there was a significant change in the tissue. So, I bloodlet 7709, punctured it, and then proceeded to puncture the more lateral Zhuqiangjing 7724 and Zhuwujing 7725. There was an immediate improvement in range of motion, and at the next visit, She told me that there was also less pain. I did a few more treatments, and by the sixth treatment, the pain was almost completely gone. Once again, I learned how effective Daoma needling truly is.
Why does the Daoma concept support the notion that Dong's acupuncture has ancient roots?
To answer this question, I need to address the Ma Wangdui medical manuscripts. These manuscripts are the earliest reference to channels that we know of today. They date to the Warring State period of the Zhou dynasty. They clearly precede the famous acupuncture text of the Yellow Emperor's Canon of Internal Medicine, the Huande Neijing, and are considered as the source of acupuncture theory and practice in China. The Ma Wangdui medical manuscripts presented only 11 channels, and no acupuncture points were listed on these channels. The only treatment method mentioned were moxibustion and bloodletting, which preceded acupuncture. So essentially, these ancient practitioners were treating areas and not points. Since the Daoma needling technique does the same, it may indicate that Master Tung's acupuncture has ancient roots.
Fascinating. Some of the Daomas are really painful to puncture. For example, on the palmar side of the fingers, they hurt like hell. According to your clinical experience, will 1 or 2 needles be enough for hypersensitive areas?
The Daoma needling on the fingers can be very painful, but it's also very beneficial and powerful. You don't really need to needle all 3 points. 1 or 2 needles are enough. To decide which point of the group to needle, you need to look at the surface and see if there are changes in the area of the points, like discoloration or noticeable blood vessels, and then needle that area. The body will show you where to needle. This is true for all Daoma groups. On top of that, one can also use palpation to locate reactive Daoma points. On the fingers, though, palpation is irrelevant, and so visual inspection is the key to finding the proper points to needle.
Name a rarely used Daoma which you especially like to puncture.
I like the Gentoo correct earth Daoma, which is located on the dorsal side of the 4th finger, on the middle segment radial line, area number 11. This Daoma has a spleen changing, and it's great for treating digestive issues like abdominal pain, gastritis, inflammation of the duodenum, nausea, vomiting, and pancreatitis. I use it when I diagnose spleen qi deficiency. It can also be used for asthma and migraine headaches. I often combine this Daoma with another Daoma, Jiewei, finger stomach. It's located on the dorsal side of the 2nd finger, on the middle segment, radial line. It can be used for treating gastritis and stomach ulcers.
James Meyer's books specify Daomas which consist of TCM points. Do you find these Daomas effective? And how does a Tung principle work with TCM?
When I first started using Dong's acupuncture, I tried to understand it through the prism of the 14-channel theory. This naturally led me to use Daoma based on TCM points. After studying in Taiwan, I realized that Master Tung's acupuncture system is different than the 14-channel theory and based on the 5 Zhang channels. So much so that today I rarely use TCM points. That doesn't mean that you cannot use Daoma needling technique with TCM points. Master Tung encouraged his disciples to study TCM. In the appendix of his 1973 book, he presented a list of TCM points, though with its own different indications. Still, when using TCM points, try to understand them through the lens of Master Tung's 5 Zhang channel theory.
Thanks, Shaun. I'm really happy that we got to talk about this pivotal technique. I can personally say that most points I puncture today in my clinic are actually Daomas. As usual, I genuinely enjoyed our conversation.
Thanks, Moshe, and I hope to see you soon. Bye.
Bye, Shaun. This was fun.
We really hope you've enjoyed this episode of Tung Talk. We'll be back soon with a brand new one. Till then, keep on puncturing and take good care.